Arizona has become a major hotspot this summer and seen a pretty big rise in cases after reopening. But this week, new cases and deaths are starting to decline again. So at this point, how would you describe the situation in your state now? And how much further would you say you need to go before you can consider reopening bars, gyms, and movie theaters?
Well, Arizona's taken COVID-19 serious since the first day that we heard of it. I think we had our first case on January 27th in the state of Arizona, but we didn't have much of a rise in cases for months and months. It was a very difficult June in Arizona. That's when everyone comes inside. We've put mitigation steps in partnership with the White House out in July, wearing a mask, washing your hands, socially distancing, dispersing large gatherings. So we've had several weeks of positive numbers. Positivity in Arizona was at 10% and decreasing. More available hospital beds, ICU beds, less emergency room visits. We find this encouraging. We're going to continue these steps and look forward to a very bright future while keeping our guard up.
Now, the president has said that he's doing everything he can to deal with this virus. Do you think that's true? And is there more that he could be doing and that Washington in general could do to help your state?
President Trump and Vice President Mike Pence and the Coronavirus Task Force have been great partners to Arizona. We have a path forward. Every time we've needed something in terms of PPE, more ventilators, dollars for our tribal nations, remdesivir, surge testing, they've been there, and they've been there with a sense of urgency. We're grateful for that. This virus has moved around the country in very unpredictable ways. In Arizona's time of maximum challenge, we had a direct line into the White House.
I want to read from an obituary posted by the daughter of an Arizona man who died of COVID. Her name is Kristen Urquiza, and she wrote that her father, Mark's death is, quote, due to the carelessness of the politicians who continue to jeopardize the health of brown bodies through a clear lack of leadership, refusal to acknowledge the severity of this crisis, and inability and unwillingness to give clear and decisive direction on how to minimize risk. What's your response to her?
Well, first I want to say that we mourn every death in the state of Arizona. Everything that we're doing, all the steps that we've taken is to reduce the spread, reduce the hospitalizations, and reduce the deaths. My heart and prayers and thoughts go out to everyone in Arizona that's been directly affected by this disease or a family member. We're going to continue to take whatever steps are necessary to protect lives and prioritize public health in the state of Arizona.
Couple questions about school reopening. You're still trying to finalize benchmarks and guidelines for reopening schools, but you yourself are pushing for schools to reopen on August 17th. So how are parents and teachers supposed to feel confident when the state doesn't know how it should happen, how reopening should happen? And what metric would you use to determine whether schools should stay open?
We're prioritizing safety in our school reopening. Distance learning can begin today. On August 17th, parents will have a safe place for children to go if they so choose. That is inside the school. But in terms of in-classroom instruction, we're leaving that to the local superintendent, the local principal. We're having our health officer, along with superintendent of public instruction, work on metrics. Probably the key one will be positivity and also different case scenarios. What if a teacher contracts COVID? What if a child contracts COVID? How to cohort smaller classes together to minimize the spread. Though that will all go into the guidance and metrics, and I'm going to leave that to the subject matter experts, but there's going to be flexibility and options for parents and teachers regardless of their situation.
Okay, I'll do one more from our local station. This is from our local station in Arizona. This has been a challenging time for Arizonans for all the reasons we just talked about. Given that, why did you feel it was necessary to be in Washington right now instead of back home working on these issues? And could you have met with the president virtually instead?
Well, listen, the first thing we want is to have a strong partnership with this White House, and this is what they've delivered to Arizona. We think the steps that we took in June to mitigate the spread and to turn the tide on what was rising cases, rising hospitalization, ICU, emergency room in a much different direction is really a model that other states can apply. So I want to thank the president for what's been provided, and we also want to acknowledge that this partnership is working and everyone should be using these steps.
Why do that in person instead of virtually?
We want to not only make certain that people understand the steps, but that Arizona has the resources necessary going forward. That's where we've been today.
Thank you so much.
Thank you.
Thank you.